Because Annie was feeling a little bit of tightness and a little bit of restriction, I want to take this a step further. And what I'm going to ask Annie to do is get well rooted. Let's get your toes pointed in. Good. Knees are soft. Tuck the pelvis. Annie, let's put our arms straight out like this. Go ahead and do that with me. And let's translate to the right. So the feet are staying flat. Pelvis is in position. Tuck the tailbone and see how far you can glide to the right through the thoracic spine. Once you've gone as far as you can, we'll come back to neutral, and then we're going to go to the left. Feet are in, knees are soft, pelvis is tucked. Work through the thoracic spine and really feel, Annie, through that T-spine. Let's come back to neutral and then go to your right again. Good job. She's keeping her head well positioned. Feel, go the other way. Thoracic spine translation. I'm actually opening up this glenohumeral joint as well. And I can feel her T-spine moving. It's almost as if I can do motion palpation with my hand on her back. She's feeling it. She has awareness. The next step that I want her to do is, Annie, we're going to go straight into our feet are well rooted, knees are soft, pelvis is tucked. Let's go way to the right. And now let's bring the right arm down, left arm up, and I want you to laterally bend. Open up those left ribs, contract the right quadratus lumborum, and then stay translated as you come up to neutral. Good. Feet are well rooted, knees are soft, pelvis is tucked. Let's laterally bend, laterally bend. Or translate left as far as we can with that lateral bending. You can bring the neck over as well. Get a full arc. See how that feels? She's opening up these ribs, breathing to open up those intercostals. And you could tell how this will guide some of my therapy decisions with the Hypervolt 2 Pro. Come back up. That was really great. Did you feel any restrictions in those movements? You didn't. That's good. You looked good. So it's not unusual to see an asymmetry or for the patient to tell me they feel some tightness in certain sections or segments of their spine. Those become my target areas to use with the 2 Pro. So let's do some therapy. Relax your arms, directed at where you felt it with the thoracic spine seated rotation with a dowel maneuver. I've introduced my patient to the Hypervolt 2 Pro, and they understand that this is a vibration percussion device, and that I now want to use that on that fascial restriction that Annie felt while she was doing the seated thoracic spine rotation move with the dowel. So we isolated, Annie, if you could just turn and face that way for me, she isolated this area, which is a really common area of tightness. It has to do with where the lats come across here, where the lower traps are and the middle traps are in this area to the lower scapular border. It's often thick and dense in an area where patients don't even realize it's tight or tense until we do some of these maneuvers. So again, I decided to use the Hyperice. I can do this with the low setting, so I'm on a 2, the second setting, and I'm going to work this area. Now, if my patient needs to be seated or lying down on their stomach or side lying, I'm okay with that. I want you to be able to feel this area, Annie. And now, with this, go ahead and put your hands behind your head. And let's have you do some rotation. Get well rooted in your feet, pelvis, neutral, tuck it, keep the ribs in, and go ahead and rotate left and right as far as you can. Good. So I'm working all along that lateral scapular border. Go as far as you can. Good. I may even need to follow that fascia into the thoracolumbar area. I'm sure this feels good. It does have a tendency to cross over to that iliac crest. Here's the quadratus lumborum here. This is more the lats. And you could see that cross fascial pattern. And this device really makes it easy and comfortable for the patient to tolerate. Annie, how does that feel?
Great.
I feel some densification through here. I can actually feel, that the device is an extension of my hand. And I can feel where it is dense or where there may be some taut, tender fibers. Thank you, Annie.